As I mentioned yesterday, my administration will be hosting daily press conferences on the current state of COVID-19 in Illinois. Depending on the updates at hand, you may see any combination of myself, Dr. Ezike, AIMA Director General Tate Nadeau, and other senior leaders of my administration and elected officials and public health experts from other levels of government each day at 2:30 p.m. We can also be viewed via live stream at illinois.gov/live video. Since our last press conference yesterday afternoon, there are 8 additional cases here in Illinois. Our total case count is now 19. These new cases include our first 2 from outside of Cook County. These 2 cases outside of Cook County, a man in his late teens with ties to Lake and McHenry counties, and an unrelated individual in her 60s from Kane County, are not healthcare workers, have no history, and have not had close contact with any known positive COVID-19 case. Since health officials cannot determine the origin of these 2 unrelated cases, each likely reflects community transmission of the virus. In a moment, I'll ask Dr. Ezike and Dr. Arwady to elaborate on the medical details of these 8 cases, as well as provide an update on the 11 previously announced. But I want to share that we have been in contact with officials from all of the impacted counties directly about the next steps in containment and protecting our most vulnerable residents. As anticipated, we have reached the point where we are likely to see additional cases reflecting additional spread within the communities each day forward. We have been preparing for this for months and are fully coordinating across state and local governments to minimize further spread as best we can. Yesterday, I issued a disaster proclamation, Illinois' version of a state of emergency, and this is the next phase in a long-developed response. We're now operating with a state emergency operations center at the heart of our response. Because of this proclamation, all our tools are in play and rapidly available for deployment to assist all our cities and counties across southern, central, and northern Illinois. As this situation has evolved, I've consistently reminded you that Illinois has one of the strongest public health systems in the nation. We were among the first states in the nation able to test for COVID-19, which we are now doing in Chicago, in Springfield, and in Carbondale, and we anticipate commercial expansion in the near future. Of course, we must also contend with the reality that our capacity cannot be separated from the material response of the federal government, our federal partners. I have personally reached out to senior federal officials to demand that we get more tests as soon as possible. It's critical to our response and to the response of every state and jurisdiction across the nation that as we see a national surge in cases, we are matching that with a rapid increase in testing. In order to best care for our patients, we need to be able to gauge the exact scope of COVID-19's spread, and it is imperative that the federal government provide leadership here. At the state level, we're continuing to make all necessary preparations to advance our public health systems. And we're doing so with a particular focus on the safety of our most vulnerable residents at the core of our efforts, paying special attention to our nursing homes, our veterans' homes, and long-term care facilities. We've implemented new staffing procedures and issued strict guidelines around restricting visitors at the facilities that we control. Yesterday, we also hosted a webinar with over 400 representatives from nursing homes and assisted living facilities across the state and are working closely with the various statewide associations of private owners to ensure that they match our efforts with similarly strict guidelines. As always, we encourage everyone to check in on their elderly friends, relatives, and neighbors, to wash their hands regularly and vigorously, and to use precautions about large crowds. We will continue to keep you fully updated and informed as we move forward.